Welcome again to Counselor Soapbox video channel. Today we're going to look at caffeine, the pros and cons. Caffeine certainly meets our normal criteria for an addictive substance. People exhibit tolerance to it. They become dependent on it either physically or psychologically, and they show cravings. While caffeine withdrawal effects are not as severe as many other drugs, most people are familiar with the phenomena of having headaches, fatigue, depression, decreased alertness, and less contentment when deprived of caffeine. They also will have decreased activity and energy, sleepiness and drowsiness, and increased irritability. Caffeine withdrawal can begin as a result of consuming as little as 300 milligrams of caffeine per day for 3 days. The acute effects of caffeine are something most people are familiar with. It has an effect on mood to elevate that mood. It can have an effect on performance. It is a stimulant drug. It can decrease fatigue, and caffeine can increase vigilance. The effects, of course, depend on the dose and the setting and the personality of the individual user. It does increase endurance and exertion. Caffeine has significant interactions with nicotine and alcohol. These are the world's top 3 drugs by use. Often, these drugs are used in combination. Smokers drink coffee, and people who are drinking alcohol often consume both caffeine and nicotine. Caffeine use reduces smokers for light caffeine users. Caffeine metabolizes faster in the liver for those who are smokers, and there's state-dependent learning for any number of combinations of these 3 drugs. While most drugs have a long list of possible diagnoses, caffeine is only diagnosable as a problem in the Diagnostic and Statistical Manual under 3 categories. Caffeine intoxication, that is someone who's consumed so much caffeine that they are having physical symptoms. Caffeine withdrawal, when a regular caffeine consumer is cut off from their source of supply. They may have the headaches and other things we mentioned in the last slide. And there's another category for unspecified caffeine-related disorder, which is rarely used but is possible. Caffeinism, or caffeine intoxication, the first of the 3 diagnosable conditions, is the result of high levels of caffeine and can look like either anxiety or stress-related disorders. The lethal dose, 50%, for caffeine is about 10 grams, so it is possible for a human to ingest a fatal amount, but it would be very difficult. This would be the result of ingesting 75 cups of coffee, 200 colas, or 100 no-dose pills. The advent of energy drinks that are high in caffeine combined with caffeine tablets can make this potentially toxic level of caffeine more likely to occur. There are some chronic effects from caffeine use. Women, the more caffeine they consume, the more osteoporosis. However, 1 glass of milk per day can eliminate this. While it's not a birth control method, high levels of caffeine can result in lower rates of conception. Coffee has not been recognized as a treatment for any illness, but there are some statistical correlations. People who consume larger amounts of caffeine are less likely to develop diabetes or less likely to die from heart disease, respiratory disease, strokes, or infections. Coffee, or presumably the caffeine in coffee, seems to be helpful in preventing some chronic diseases. There are reports of coffee drinkers having lower rates of liver disease, Parkinson's, type 2 diabetes, cirrhosis of the liver, especially alcoholic cirrhosis, reduced risks of developing Alzheimer's, and there have been some reports of reduced risks of pancreatic cancer when the caffeine is consumed without sugar. Who might need to reduce or limit their caffeine use? People with anxiety disorders, and caffeine certainly makes symptoms of an anxiety disorder worse. People suffering from stress or trauma-related disorders should also reduce or eliminate their caffeine use. Pregnant women and small children might also be advised to use less or no caffeine. Caffeine has medical or therapeutic uses. While it's not an approved medicine or scheduled that way, it is included as an ingredient in many over-the-counter medications. If you look at over-the-counter meds, you will find caffeine as one of the first 2 or 3 items, ingredients listed on many labels. Caffeine can be used in over-the-counter medications for treating headaches, colds, respiratory problems, appetite suppressants, diuretics, and for medications for alertness and drowsiness. Thanks for watching another Counselor Soapbox video. What's ahead? More drug education videos, many about specific drugs. Also, some mental health and wellness videos. If you've enjoyed this video, please click the like button, which is directly below this. Comments are always appreciated. And to receive new videos in this series, please subscribe to the Counselor Soapbox video channel. Thanks for watching the Counselor Soapbox video channel. For more information on this and related issues, please visit the Counselorssoapbox.com blog, where you'll find over 1,500 texts, articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are now available on a wide variety of ebook sellers platforms. The photos here are all courtesy of Pixabay and Wikimedia and are licensed under the CCO Creative Commons free for commercial use, no attribution required license. Thanks again for watching.